Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, pediatrician and an endocrinologist in America. Today's video is focused again on USMLE, and the topic is 10 reasons why you can fail in USMLE Step 1. Step 1, as you all know, folks, is the most important step in USMLE test series. The reason is that USMLE Step 1 scores are used as the basis for your selection for the interviews for the residency and ultimately your selection as a future resident. So although it is the first stone, the first stone means the base, and the base will indicate how well you will construct your building on it. So the program directors, they all take Step 1 scores very, very seriously. Before we go forward on this video, please like it, share it with your friends, and please subscribe to my channel and follow rest of my videos on USMLE steps. So USMLE Step 1, like I said, is the foundation stone on which your building or your future life will depend and build on. And scores which are less than 215, they're really, really low and may mean your failure. 215 to 230 are fair, 230 to 245 are good, and anything which is above 250 is considered as excellent. So there are 10 reasons that you might fail in USMLE or fail to achieve a good score to make your application, once you apply for the residency, a very strong one. The first reason is a lot of people, they may take up USMLE following other people's lead, and this is true for people who are IMGs, and not realize that what is expected in this exam. So they just don't understand what they are getting into. They don't have the passion, and it is kind of a half-hearted attempt that, okay, I have time, I have money, you have to pay $965 for sitting in the exam, might as well take it. Those are the reasons that sometimes people fail to realize what they are getting into. So it's very important before you take up or you send the application for USMLE, know the reasons why you are taking the exam, and then know the standards that you will need to follow to reach to a successful result. Know what is the syllabus, how long would it take you to prepare for the syllabus, how much time do you want to spend on the review videos, the review MCQs, the Q banks, the Ankis, and how are you going to pace your preparation for the exam to take the exam. And as the second reason for failure is that people fail to realize what is their strength and what is their weakness. So they leave the important stuff and don't review it. USMLE exam for IMGs have to understand that they cannot leave one side weak. That okay, I will just pass on this and still hope to get a good score. No, you need to be good in all the subjects based on the required standard for USMLE to score well. So that is another thing. So if you're weak at a certain subject, make sure that you give some extra time, try to learn more about it, and whatever things you don't know, try to repeat them, review them, so that they become your strong point instead of a weak point. There are a lot of resources available. So the third reason why people fail is that they get into too many resources. They think that they can do everything. No, you need to find the right resource of learning. You need to know your syllabus, okay, and then which is the most likely path that you will take to get the basic knowledge, and then do the QBank, Anki, and videos to strengthen your basic knowledge. So you can use the board review series for all the basic sciences, anatomy, physiology, biochemistry, pathology, anatomy, high yield anatomy, high yield neuroanatomy, to learn these basic sciences, biostatistics and behavioral sciences, so that you know the basics of all these subjects, have reviewed them, and then you have to build on that knowledge. The strategies that I do is, people like to do one subject at a time, which is fine, and if that is your strength, then that is okay. What I used to do is to take the blocks. I would take, say, a block of cardiovascular diseases and physiology. I would do the same cardiovascular medications in pharmacology. I would do the same thing, cardiovascular anatomy. So there is a continuation of your knowledge acquiring. And then if I would study for 4 hours in the morning, 2 hours block, one subject each block, then the third block I would do the Q bank. And the Q bank would also be from the cardiovascular diseases or cardiovascular system. And once I have done the cardiovascular system, I would review those Anki high yield points for 1 hour, and that Anki. So in 1 hour of Q bank, you have 60 minutes for 40 questions. You can do them and then go on to the high yield Anki things. And those high yield Anki decks that you are doing, and if you get them wrong, either you can automatically set up that those questions are again and again asked, so that they give you a firm memory, or if you are doing manually those cards, you take those out that you don't know, and you keep on repeating over the next few weeks randomly, so that your knowledge is strengthened and is solidified. So that's how you will build and strengthen your weak points, by repeating the points that you have studied. People fail to do the USMLE first aid to step 1 from the beginning. So I would also give 1 hour every day to the high yield facts, and the same high yield facts that I'm studying. If I'm doing the cardiovascular system in physiology, biochemistry, and medications and pathology, pharmacology, so I can do the high yield facts for those topics from the first aid as well. And keep on reassessing yourself. So if you are planning that you can review all these basics books in, say, 3 months, that would be a great achievement. And then once you have done Q banks as well, then Q word, then you might want to take the NBME test. And that NBME test is the fourth reason people fail, because they do not realize that if they have a low score on these tests, the chances are that they will have a low score on the USMLE as well, and they may fail. So this was the fourth reason why people fail, or rather the fifth reason. The sixth reason is that people failure is that people do not tend to target at a good score. They just want to pass the exam. So if you are just trying to pass the exam, the chances of failure are much higher. Say you are a US graduate and you just need to pass the exam, you think that would be sufficient. Or you want to just get a good enough score and not a really good score. So that is another error that you will make, and that will increase your chances either getting a very low score around 215 or below that. So that will not be good on your resume and on your test score sheet, on your transcript when you will apply for the residency. So try to target a score of 250 or even higher, so that even if you don't get 250, you may get 240, 230, at least good enough score, because any score above 230 is considered to be as good. The fourth thing is people do not have a strategy. Like I said earlier, seventh reason to fail is they don't have any plan. So like I discussed the plan already, that okay, you will do two 2-hour blocks for the basic science subject, and 1 hour block for the Q word, then 1 hour for Anki, 30 minutes for first aid, and repeat the same thing. So you are studying about 12 to 13 hours a day, say for up to 3 months. Some people may want to do it 2 months. IMGs have 8 weeks to prepare. Sorry, the US graduates have 8 weeks to prepare, while IMGs can take up to 3 to 4 months for these basic sciences subjects. And then 2 months of dedicated time towards the Q word, Anki, and the videos, so that all the knowledge is solidified. But don't go more than 6 months, because the longer is the time of preparation, the more you will start forgetting things. So remember, our brain has so much ability to keep these things in our mind. The longer the duration from the start of your exam, the longer would be your chances, higher would be your chances that you will start forgetting it. People sometimes say, okay, I'm going to do it once and then I'm going to do the whole course again. Again, it depends on your ability. If you were not a good student during the medical school and you want to do the basic subjects 2 times before you start embarking on doing the Q word and Anki and videos on a regular basis, it's up to you. But do not drag it too long. The longer you drag, the higher is your chance of scoring less. So this is a very important thing. People fail to achieve good result is that they drag this period of preparation for exam for too long. The 8th reason people tend to fail in this exam is that they do not choose a good study partner. Because remember, your study partner has to be someone who knows more than you, probably, because then he will be adding to your existing knowledge. If someone who is inferior to your knowledge probably will not add as much value, you may be able to discuss stuff with him, you may be able to teach your partner, that may help, but ultimately you want someone at par or even better than you to be successful. Same is with the USMLE forums. You may join them, but the questions or the recall questions which are reported may help you, but they may not only be the reason that you will acquire a score more than 230. So that is the reason you have to find the balance. Good partner on the USMLE forums and the review questions, but not a weaker partner, because that can drag you down, or partner who is not serious. He's just taking this exam for the sake of it, is not really prepared, doesn't want to shoot for a higher score, doesn't want to prepare or put in the extra effort regarding which is needed for a good score. The other thing is, the 9th thing is pick a test date, okay? And during this test date, you want to say, achieve this goal in 6 months. You want to achieve this goal in 2 months. You want to achieve this goal in 4 months. So after analyzing your NBME scores, you know that, okay, I am ready for the exam. I'm scoring 70% or higher. I can do it. I can, ace the board and take good score. But if you are scoring 40 to 80% or even lower on NBME, don't take the test. It takes, $80 to reschedule the test. Just reschedule it so that you can have some extra time to practice the Q word, the videos, the Ankis, or review those topics that you're weak in, so that when you take the NBME test, then your score is higher, close to 80%. So that will help you in passing and achieving good score on USMLE. The third reason, the 10th reason people fail this exam is that they become doubtful of their abilities, scared of the exam, they become sad if they don't score well, or the other people who are preparing with them, their partner is doing very well. So do not get bogged down, do not get depressed. If you missed a day here today, the next day is always a new day, and you can always catch up by minimizing the dead time, or minimizing the time that you were wasting, or just add 1 hour to your daily schedule overall. So that will cover up the lost day, because some days we may be sick, we may have to visit someone, or a relative is sick, we have to visit their family, we have to go in a wedding, but that should be a very short time. You have to remember that you have to tweak your schedule all over if you miss a day. So consistency and a positive attitude is very important for the exam, and people who fail to be successful lack a positive attitude and a consistency in preparing for this exam. So hopefully these reasons will be good for you to identify them, and do not do these things so that you don't end up failing or achieving a very low score. I wish best of luck to all of you. Hopefully this video was useful to you all. Please subscribe to my channel. Thanks a lot and best of luck in your exam. Sallallahu alayhi wa alihi wa sahbihi wa sallam. Thank you.